Coming up on Mayo Clinic Q&A.
Most of the time, there are no signs or symptoms, and that is a problem because it's a silent disease that progresses over time until there is an acute rupture of the plaque. And when that happens, a clot can form in the surface, and the clot can be pushed downstream to the brain, and that is what causes the stroke.
These clots can form if you have carotid artery stenosis, a disease where fatty deposits clog the blood vessels that deliver blood to the brain. This blockage increases your risk of stroke, but with early detection and new therapies, injury to the brain can be prevented.
And by looking at the wall of the artery with basically next generation imaging tools, we can see the root cause of stroke. And in those patients where we can find the problem, we can really help them by targeting our therapy.
Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. We are going to learn something together today, and the topic is carotid stenosis. Carotid artery stenosis is narrowing of the large arteries or vessels on the sides of the neck that carry blood to the head and the brain. This narrowing is usually the result of a buildup of fatty deposits, known as plaque, within the arteries. Stenosis can worsen over time to completely block the artery and cause what we know as strokes. So what are the signs and symptoms, and how can carotid artery stenosis be treated? Well, luckily we have an expert here to talk to us today. Dr. Luis Savastano is a neurosurgeon at Mayo Clinic. Welcome, Luis. Thanks for being here.
Thank you, my pleasure.
Wonderful to have you here to talk to us about this today. Thanks for being here. Luis, tell us, how common is carotid artery stenosis?
Yes, carotid artery stenosis is very common, especially in elderly patients. And about 5 to 7% of patients 75 years of older are going to have carotid stenosis. It is important to remember that is one of the most common reasons for stroke and is causing at least 25% of all the strokes.
Wow, that sounds very common then. And how would someone know if they had carotid artery stenosis? Are there signs or symptoms?
Yes, most of the time there are no signs or symptoms, and that is a problem because it's a silent disease that progresses over time until there is an acute rupture of the plaque. And when that happens, a clot can form in the surface, and the clot can be pushed downstream to the brain, and that is what causes the stroke. And most of the signs and symptoms of stroke patients are going to be difficulties moving one side of the body or feeling, or some language problems, difficulties to talk or to understand.
How do you diagnose carotid artery stenosis?
There are two settings where carotid artery stenosis is diagnosed. One is in patients that have a family history of a carotid artery disease, and they are smokers and they have high blood pressure and have high cholesterol, diabetes, and the primary care provider orders basically screening test that can be an ultrasound of the carotid or a CAT scan of the arteries of the neck. And most of the time, those are asymptomatic carotid stenosis. The other circumstance is when patients present to the hospital with stroke symptoms, and in the workup of the root cause of the stroke, there are images of the carotid obtained showing the narrowing.
Dr. Savastano, it sounds to me like the risk factors for carotid artery stenosis may be fairly parallel to those for coronary disease or heart disease. Is that true?
Absolutely. Keep in mind that atherosclerosis, which is the reason of the narrowing or these plaques, is a systemic disease, meaning that happens everywhere in the body, especially in patients that are basically smokers, high blood pressure, they have poorly controlled diabetes, and the same that is happening in the coronary arteries in the heart happens in other arteries in the body, such as the carotid arteries.
So if a person is known to have coronary disease, they should know that they could be at risk for this as well?
They could be at risk, yes. And it would be reasonable to do a screen for that.
And is a screening test, are there any blood tests that can be screening tests, or is it imaging tests like the ultrasound?
There are blood tests that can be done, but those are mostly for the systemic risk factors, such as the cholesterol level, the lipid levels, the blood sugar level. I think it's important if patients are in those risk factors to talk with the primary care physician to see if they are good candidates for health screening.
Okay, so supposing that someone does not have a diagnosis or is unaware of this, what can happen if it goes untreated?
Yes, there is a potential that the plaques are going to progress over time, and they may eventually rupture. When that happens, there is a clot forming in the surface, and the clot can block the artery, or the clot can fragment and go to the brain, causing a stroke.
So how do you prevent that? What are the treatment options?
So it's important to consider that the first thing to do is to improve the medical management of the patients. By that, I mean a healthy living, healthy lifestyles, exercise, having a healthy weight, control the diabetes, if the patient are diabetic, keep the cholesterol levels down, and control the blood pressure, and of course, stop smoking. Once the plaque becomes symptomatic or the patient is having a stroke, if there is a significant narrowing, the treatment on top of the medical management includes basically repairing the artery. And overall, there are 3 techniques that can be used. And one is basically removing the plaque through surgery, which is called carotid endarterectomy. The second option is to place in a stent through a catheter placed in the groin or in the wrist that is advancing towards the carotid. And the last option, which is the most recent, is placing a stent directly from access into the carotid artery in the neck, which is called transcarotid artery revascularization.
Interesting. So with the surgery, you actually make an incision in the neck and go into the artery.
Exactly. Yes. And then basically the artery is exposed and is open, and then the plaque is completely removed. And then the artery is basically closed back up to reestablish the flow to the brain.
Okay. Or you can go through the groin and put a stent in.
Exactly right.
And with the third option, how big is the incision or the entry point into the neck?
The incision is about 1 inch in size. And it's kind of a hybrid approach. It's a combination between an open surgery and a stent intervention.
And what important? Oh,
yeah,
sorry. I'm sorry,
yeah.
Dr. Savastano, go ahead.
Yeah, I think there are several nuances to discuss, basically to decide which is the best option for a patient. I think it's important to consider that the 3 are very good options. They are very effective and have a very good safety profile, but there are certain features within basically each patient that makes one option better than others.
Okay.
So it's always good for patients to try to go to centers that they're very familiar with all the available options.
Can you give us an example of why one approach might be preferred over another?
Yes. For example, endarterectomy, which is the open surgery, is the oldest and the most established technique. Having said that, the neck needs to be relatively healthy to do surgery. And for example, if the patient has a history of radiation in the neck or has a history of multiple neck surgeries for other things such as cancer, the dissection to expose the artery, it's more challenging. So in those cases, it's more convenient for patient to have the stenting. The same happen about where is the location of the plaque. Sometimes the plaque is kind of the middle of the neck and is relatively straightforward to access surgically, but sometimes it's very high behind the mandible, which is more difficult to get a good approach.
That's interesting.
In those cases, stenting is preferred.
Very interesting. And how do patients know, Luis, if they are getting the right care for themselves for carotid artery stenosis?
Yes. So I would start saying that when patients are having symptoms for stroke and they're diagnosed with a stroke, it is critical to find the root cause of the problem. Because if you cannot target your treatment, it is unlikely that you're going to provide the best benefit to patients. And the benefit is preventing a future stroke. And at Mayo, we have clinics which are multidisciplinary And basically they have specialists which involves neurology, stroke neurology, cardiology, vascular surgery, and neurosurgery, where we work together to understand why a patient had a stroke. And once we understand that, the next question is how can we best prevent another stroke from happening? And that is a discussion that needs to happen within teams. And based on the consensus, then we find the best option that we have for the patient, and that is what we offer them.
That team-based care sounds like a great option for getting all of your information and care in one spot.
Yes, absolutely. And the other thing to consider is that in addition to have a streamlined process to provide that basically multidisciplinary care, is important to understand that there has been an evolution of the techniques and the tools that we use to find the root cause of a stroke. For example, for many years, we have thought about narrowing of the arteries as the main problem.
Right.
What we learned in the last decade or so was that in addition to the narrowing, the reason of the narrowing in the artery is critical. And if there is, for example, a hemorrhage within the plaque or a bleeding within the plaque, we can prevent strokes by fixing the artery, even if there is no significant stenosis or narrowing.
Interesting.
And to see the plaque, you need the technology. And at Mayo, we have kind of specialized MRIs to see those problems in the arteries.
Like so many things, it's important how many of these surgeries you do and how many cases you see, I'm certain.
Yes, exactly. So, these are well-established surgeries and interventions, but it's important for the centers to maintain a complication rate of 3% or less. And that is something that is tightly regulated. So, and of course, the more you do, the safer it is for the patients.
Oh, it's very interesting. Anything else you'd like to share today, Luis?
So for a very long time, the focus of our attention in carotid artery disease has been on the degree of narrowing. And what we have found and what we're doing our patients now is to look at the wall of the artery in addition to the degree of narrowing. And by looking at the wall of the artery with basically next generation imaging tools, we can see the root cause of stroke in patients that otherwise are labeled with strokes of unknown reason. And in those patients where we can find the problem, we can really help them by targeting our therapy, both medically and with surgical interventions.
I think it's really interesting you mentioned that, because I remember being an anesthesia resident and, reading patients' charts who were going to have carotid endarterectomy, and the main decision-making seemed to be what the ultrasound or other imaging study showed was the percent of blockage of their artery.
Yes, exactly. And that has been a dogma within basically a stroke. And Mayo, we're really pioneering basically a change in that dogma. And we have basically the largest published series of patients undergoing surgery for minimal to no stenosis, and showing that we can really prevent recurrent strokes. At the same time, here at Mayo, we are the principal investigators of an NIH trial, specifically looking at interventions for non-stenotic carotid artery disease.
Oh, interesting. Thank you so much for sharing with us today.
Absolutely, my pleasure.
Our thanks to Dr. Luis Savastano for being here today to talk to us about carotid artery stenosis and its diagnosis and management. I hope that you learned something. I know that I did. We wish each of you a very wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.